Welcome, everyone, to the Success Elevated podcast. As always, I'm your host, Hayden Lee, and I am joined this week by a very special co-host, Katie Harris, managing partner here at Spot On Solutions. Very excited to have you on for a really, really cool special series of episodes, which we're going to talk a little bit about what we're doing here. But we have a very special guest on this week, Ashton Holbrook. We're going to call him our resident mental health expert. But Ashton, if you wouldn't mind, maybe take a couple minutes here and kind of introduce who you are and all your various certifications and all the things that make you who you are.
Yeah, thanks for having me on. Expert it's got to be a loose term. It takes one to know one in this field, right?
All right.
I mean, we all have our issues, but no, I've been in mental health now for about 10 years. I love this work. I'm passionate about it. I've enjoyed the type of work that I do. Currently, I work in an inpatient psychiatric hospital, and really enjoy that work. As far as my credentialing and stuff like that you mentioned, I do have a master's degree in social work, and some other certifications that come along with that as well. I have been trained in a lot of different counseling interventions, CBT, different CBT interventions, which is like cognitive behavior therapy. So stuff like DBT and ACT as well. I've also been trained in what's called nonviolent crisis intervention. So I'm a trainer for that and also can do those groups as well. And I've also done some stuff with like first responders as well and helping with them, like I guess debriefing after those incidences and stuff like that. But a lot of interesting experiences, as you can imagine. Of course. I've worked, like I say, in hospital settings. I've worked in private settings. I've worked in community settings. I've seen just about anything you can imagine at this point in my career. It's probably pretty safe to say that there's nothing at this point that would not surprise me. As far as
you've seen just goes. About everything.
Yeah. There's a few terms I've learned along the way as well, from other nurses and stuff like that. Like if it's warm, wet, and not yours, don't touch it.
Okay, right. Yep, that's a good thing. Yep.
That's, some good advice there, right? But just stories too. I mean, some on the serious side of things as well. When you're working with people when they have mental illness, and when you're working with people who have had struggles in their life, you get to see kind of the resilient side of things. You get to see people kind of go through their struggle, go through their journey, and kind of come out of the other side of things and come out with a different perspective on things and having gained knowledge, gained an experience that's changed them.
I love it.
And so that's another part of my job that I'm really grateful for, that I get to experience. And so, I don't know. It's never the same thing twice. My day is always different. And like I say, I've been in this for like 10 years. And so it's kind of a second career in a way too, because prior to that, I worked in retail, I worked construction. I had a lot of other different life experiences too. So I feel like, I don't know, it's just kind of got a lot of different I've got an eclectic background. Let's put it that way.
That's great.
So I've had a lot of cool experiences that have brought me to this point in my life. So
I love it. Well, we've kind of just jumped right into this podcast here, and I want to make sure for our audience that's listening that we have some proper context. Why would we at Spot On Solutions, a digital marketing agency, have on a mental health expert? Katie, this was kind of your brainchild from the beginning. Why did we decide to do something like this?
I know, sometimes I come to you, Hayden, I'm like, I've got an idea. And you're like, oh no.
Generally those ideas happen on the weekends or late after work. I get a random Slack message saying, we should do this. So,
well, I've had something on my mind for the last several months. And then I realized that May is actually Mental Health Awareness Month. And so rewind about 3 months ago, we were doing a quarterly planning and we were talking about some upcoming podcasts. And this thought just kept coming back to me about mental health awareness and what is our role in it? What is my role in it as an owner of a business? Between Get Found First and Spot On Solutions, we have over 60 employees that are here. And I know that mental wellness, mental health is something we talk about a lot, and I could see it affecting people. Working with clients all the time, I could hear their stories about things they were facing. And I know that this is a topic that needs addressed.
Yeah.
I also feel like we live in a digital world, right? We're literally pitching people all the time to buy digital services. And I felt a little bit of an obligation to dive into what is happening, you know, in our workforce, in our communities, in our lives, surrounding mental wellness, mental illness, mental health, and what role does digital marketing play in that?
Yeah.
And what role do we have as business owners and entrepreneurs to not only look out for ourselves, because we're leading teams of people, but to look out for our teams. And so that's where this kind of started. And then I met Ashton. We've had some great conversations. And I was like, this is the conversation that I think not just this industry needs, but everybody needs. I think that's one of the first things you said to me, Ashton.
Yeah, I don't think it's something that we talk about enough. I mean, I think mental health in general is just something that it's just not spoken about enough. I think people shy away from it. I think people get
stigmatized for sure.
Yeah, people get uncomfortable talking about it. You know, people are like, you know, oh, I feel depressed today. Oh, well, okay. You know, they don't know how to react when someone talks about those kinds of things. And certainly when we look at, you know, you talk about the digital world, right? When we look at things like social media, when we look at things like movies and other forms of entertainment, what, you know, is presented to us is this perfect idea of what our lives should be like. And life is not that way. Life is messy and hard, right? And there's this, you know, very big difference between what is and what we're told to be. And that difference creates a lot of problems for a lot of people.
Big time.
Yeah.
One of the statistics that really stood out to me, and I think, Hayden, it's one of the first things I brought to you, is pretty much every source I go to says 1 in 5 people are affected with mental illness or at some point in their lives. Is that true? Is that a fair statistic?
Yeah, it's about 20%. And in fact, I was just looking at some data this morning, and 2021 was the latest data that I could find on the government website, and it was 23 point something percent was what it was.
Yeah.
Slightly higher among women than it was among men, but yeah, about 20% of the population.
So when you look at that, though, like
it's a
I look
huge
at
number.
our team specifically, and I'm like, okay, I come into this building every day and really genuinely care about every single person that's in here, right? I hear our clients talk all the time about how much they love the people that are working on their teams, and they want to provide a good culture. And there's a lot of buzz right now about how do you provide a good culture for the workplace? How do you, you know, retain employees by providing a good culture? But what we never talk about is what role mental health plays in that.
Yeah, I think even to go beyond what you were initially talking about is like our duty as like a digital marketing agency. I think it even goes with that statistic in mind, the 1 in 5 people, 20%. I think it goes beyond that. I think it like our duty as just a human on this planet is to like better understand mental health and how do I help myself have, you know, good mental health and overcome mental illness, and how do I help the people around me is like my duty as a person. You were talking about, so 1 in 5 people, we have 60 employees here in the office. So you're talking at least, you know, 12 of us are dealing with some kind of mental illness, right? And like, so like that's a good portion of, that's people I interact with every day for a good portion of my day.
And there's a good chance that, you know, if you want to put a number to it, right, 12 out of those 60, right, it's not going to be the same 12. Right. That 12 is going to fluctuate.
Yep.
It could fluctuate from day to day, right? I mean, it could fluctuate, you know, depending on, you know, what time of the year is, what's going on in those people's lives, you know, spouses dying, divorces, you know,
whatever could be happening.
All kinds of different issues going on, right? And so that target is constantly moving, right? It's not something that necessarily is going to stay. It's just those 12 people.
Yeah.
Yeah. Right.
So I was really interested when we first started talking. You were talking to us about what is mental health, right? Like when we even say that term, let's make sure we're all talking about the same thing a little bit.
Sure. And I think I kind of use the example of a pendulum, right? And that's an example that I use a lot when sometimes a patient's family member will call me, you know, in the hospital and say, hey, what's going on with my son or my daughter, right? And I'll try and explain it to help them understand as best as I can, you know, what's going on. And if we can think about how someone's behavior or mood is throughout the day, right? We all have our different swings, right? We all move back and forth all day long, right? You wake up in the morning and your alarm clock didn't go off. And so all of a sudden you're starting off on the bad foot. You're a little bit angry, you're a little bit irritable, right? You're driving to work and the traffic's bad, your coffee spills, right? You get in, there's 50 emails that you've got to read, and you're feeling all this stress and all this pressure, and that pendulum is swung way over to that stressed out, angry, irritable side, right? And then 10 o'clock, 11 o'clock rolls around, you got another cup of coffee, and you got your bagel, right? You've had your Snickers bar.
Settle down a little bit.
You've settled down, right? Your pendulum swings back, right? You're mellowing back out again, right? And then something else comes up and it swings again, right? And so that mental health is just kind of that normal swinging of, if you can think of it, of kind of how you react to your environment, how you're emotionally reacting to what's going on around you, right? And how you're functioning with that, in your day-to-day, right? Your what we would call your activities of daily living, the way that you're responding to those things. Are you showering regularly? Are you managing your stress? Are you managing your relationships? Are you eating healthy? Are you, handling all those things normally, given all of those normal stressors that you have coming into your life, right? That pendulum swings back and forth, right?
Yeah.
And each person has their own normal balance, right? And it's different for everybody.
So some people, it might be normal to have big, huge swings, right? And that might be perfectly normal.
Right, yeah. Someone, they're a little more animated, they're a little more higher energy, they're a little bit more, busy bees, we might call them, right? Maybe they're a little more like myself, we're a little more stoic, they're a little more low-key.
More reserved,
More reserved, more quiet.
Pendulum looks a little bit more like this.
Yeah, exactly. Yeah. And that's for lack of a better term, I use it loosely, but that's normal, right? You're able to swing back and forth, right? And the pendulum, there's two ends of the spectrum. There's what we'd call the positive end and the negative end, and I don't use that as in positive good and negative bad. I use that in positive of what is adding to you and negative of what's taking away from you. And so the positive being, is it making you more irritable? Is it making you more angry? Is it increasing your anxiety? Is it increasing your agitation, right? Are those stressors, those events throughout the day, making it more of that, right? Or is it having the opposite? Is it taking away? Is it making you more depressed? Is it making you more isolative? Is it making you more, wanting to avoid things, right?
I love the idea of a pendulum because there's so many different ways you can talk about mental health. The pendulum idea gets my engineer brain going a little bit.
Sure.
And so I think about, in engineering, we talk about with sound waves, we talk about frequency and magnitude, right?
It's funny you mention a wave, but I'll come back to that.
Yeah, okay. So like with a pendulum, there's probably multiple different ways that your mental health could, or a mental illness could come out, right? Like the pendulum is swinging back and forth very quickly, or the swings are big. Maybe it doesn't happen very often, but the swings are huge, right? So like there's multiple different ways that this pendulum of mental health could be swinging in your life. It could be that you're having, the swings are happening a lot, the frequency of the swings, or the magnitude of the swings could be very, very large. And you described, when you were talking about the difference between someone that's more reserved or more outgoing, or not even outgoing, just more animated, you described my wife and I to a T. Like that's my wife is very reserved and keeps her emotions very level for the most part. She might have a higher frequency of some of those swings, but the magnitude is not great. Right. Me, on the other hand, I find myself much more animated. I get frustrated and more angry than she does if something happens bad in the day or whatever, but maybe it doesn't happen as often. And so the description of the pendulum just makes so much sense to my brain when you're talking about this, because there's multiple different ways you can kind of talk about your mental health or mental illness or how it's representing in your life.
Well, I mean, introverts and extroverts, right?
Yeah,
I mean,
totally.
My wife and I are kind of the opposite in that regards too, right? Yeah. I mean, she can go hang out with her friends and have a wonderful evening and feel totally recharged, right?
Yeah.
End of the day, I'm like, let me sit at my chair. Let me have a book. Let me have a few minutes to relax. And that's what I need to recharge my batteries. Right. And so it's kind of along the same lines. And not only does that pendulum swing, but when we're looking at persistent mental health issues, right, that pendulum is going to get stuck. Right. So let's take depression, for example. Okay. So one of the symptoms of depression, of major depressive disorder, is losing interest in activities that you would normally find interest in. Okay, so let's say you normally enjoy fishing, right? If you're struggling with depression, fishing is not something that you're going to find enjoyment in doing anymore, right? And so that pendulum, fishing is something that helps bring your pendulum back to normal, right? But that pendulum is now stuck, right? It's stuck over here in that, negative part, right? That area that's wanting to cause you to isolate, that's wanting to cause you to avoid other people, and having these thoughts of self-doubt, or all those other things that are associated with depression, right? And so when we're talking about persistent mental illness, right, not just the way
not just
the normal
regular daily flows.
right, yeah, but when we're talking about persistent mental illness, right, that pendulum's going to get stuck, right? And so it's not just swinging anymore. It's stuck at one end or the other, right? And it's that's when it's time for help, right? That's when it's time for reaching out and trying to get it unstuck.
That's a great. Sorry, Kate. It's just a great way to recognize it within yourself is the hobbies or the things that you normally enjoy. If you're, that's a great way to be like, something's going on if I don't enjoy this thing anymore. Yeah. Sorry, go ahead, Katie.
Well, I was going to say right along that, right? One of the things we can do to recognize it in ourselves or others is things we normally enjoy, we don't anymore.
Yeah.
What else are maybe some things that you see?
Well, I mean, if we're speaking about depression, right? I think losing interest in hobbies is one thing. Isolating is another thing. Increased irritability is something that would be another issue. Not taking care of yourself might be something. Yeah. Feelings of hopelessness, feelings of doubt, right? Excessive weight gain, excessive weight loss, things like that. There's a whole, criteria of them. We can start looking at other, mental illness too. I mean, if you start looking at things like anxiety, right? There's overlap among them too.
Which I think, for me, the thing I hear the most and come across the most is anxiety. Mm-hmm. Is that fair?
Oh yeah. I see that a ton. And in fact, in when I've done my work in the hospital and in the communities that I've done, anxiety underlies almost everything.
So is it more prevalent now than it used to be?
I think it is.
Yeah.
I think it is. I do.
And why?
I think social media has a lot to do with it. Like I mentioned earlier, I think that we are constantly bombarded by these messages of, you need to have a perfect life. This is what perfection is. This is what you need to be doing. This is how you need to be living. This is what you need to be making. This is, boom, 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 boom. But yet our lives aren't, life is not that way, right? Life is messy, life is hard, life is difficult. And we see this expectation and we see reality, and then that big gap between the two just gets filled up with this emotional anxiety that we have. We fill that up, Like, when was the last time you ever just sat in a room without your phone, with nothing, and just sat and tried to sit in the silence?
It's so hard. I got challenged to do this. I got challenged to go 5 minutes every day, like no phone, no anything. And that made me anxious. Mm-hmm. I couldn't go a minute.
Yeah.
And so what I ended up having to do, because I really kind of dove into this, it freaked me out a little bit. I was like, why can't I just sit here and not do anything for 5 minutes? Yeah. 5 minutes is not very long. And so I started going for 1 minute. Mm-hmm. And I could do 1 minute. And then when I wanted to get to 5 minutes, literally what I did is I set a timer on my phone and I went out and gave it to my assistant. And then I found out really fast that meant I also needed to take off my watch and go give that to her as well.
Yeah. And what you're actually doing is actually a therapeutic technique, right? Because that you're feeling anxious about your anxiety, right? I'm anxious about my anxiousness, right? And so the worst thing that let me back up. I'm getting ahead of myself here a little bit.
You're good.
When you're anxious about something, when you're upset about something, when you're fearful of something, the worst thing you could possibly do is avoid that.
Oh, yeah.
Right?
Sure.
Because then you're just reinforcing to yourself, I need to avoid that, right? If you want to overcome that, you have to lean into it, right? But the trick is, right, it's fearful, it's scary, it's causing me this, painful chest and my sick stomach, right? So, how do you do it, right? Well, that's where therapists can come in, right? We can help with that, and that's one of the things we do, is you start small, and just by talking about the things that you're anxious about, you start to familiarize it, and you start to break down that fear, and you start to break it down into manageable amounts, right? And what you're actually talking about too, with the minute of no stimulus, right, is a DBT intervention with mindfulness.
And remind me, what does DBT stand for?
Dialectic behavior therapy.
Okay.
Right. And the big thing that drives DBT is acceptance, right? And so you'll sit there and you'll have this meditation, right? And you'll just kind of mindfully be present in the moment, and you'll start to think, just be focusing on the moment. You'll start to think, oh, I've got all these bills to pay. Okay, well, I've got to let that thought go, right? And then you think, oh, my butt starts to hurt because the seat's uncomfortable. Oh, well, you let that thought go, right? And it's this practice of just training your mind to let things go, right?
Wow.
Yeah. And I mean, it's Buddhist monks have been doing it for thousands of years, right?
Right.
But it's so hard for us to find that quiet. You think that's really a contributor to increased anxiety, I think.
I do, because our minds are constantly racing, right? We live in a world where we have to have constant stimulation, right? And we haven't, like, my wife and I were having this discussion this weekend. My son, my 13-year-old, wanted to have a friend over, and she's like, well, he's bored. Let him have a friend over. I'm like, let him be bored.
Yeah.
Let the boy be bored.
Yeah.
Right? Because there's value in boredom, right?
Yeah.
We don't have to always be stimulated mentally, right? There's value in just letting your mind be.
Yeah. Okay, so I might be wrong. If I'm wrong about this, tell me if I'm wrong about this. And Hayden's younger than you and I, so
Sure.
he may take offense at this. And
Okay.
I'm sorry,
All right,
Hayden,
fine. Whatever.
if I do that. But
No, you're good.
is it a generational thing a little bit?
I think it is.
Okay.
I think it is. I was given this some thought too, because I think that if you look at, and this gets away from kind of the clinical work that I do, right? This is really more just kind of my opinion, but it's based on a lot of observation over the last 10 years. So I will say that.
Okay, fair enough.
So
it's got some credential behind it.
Yeah. I do think that there's a lot of value in trying to understand why we do things, right? Yeah. And when I think that if you look at kind of the younger generation who are entering the workforce now, right, that 18 to 35-ish range, right?
See, look, he called you young. You fit right in that young range.
18 to 35.
18 to 35.
I'm right smack in the middle of that.
I think that's a good place to start, right? I think if we look at that age range, right? That and like it or not, right? Not being overly critical here of anyone or saying anyone did anything wrong, but I think if you look at that age range, a lot of them were raised, everybody gets a trophy, everybody's important, everybody's special, everybody has their individual worth and values. And while I don't disagree necessarily with some of those things on principle, it creates an environment where there's not a lot of challenge.
Yeah.
Right? Yeah. Where there's not a lot of chance for what's the word I'm thinking of? Kind of refinement, if that's the right word. I'm not sure if that's the right way to put it. Resilience? Yeah, there you go. And so there's something to be said about falling down, getting hurt, and getting up again, right? And I don't want to send the message that mental health, that's what that is, right? That to deal with depression, you just have to, tough it out, right? That's not what we're talking about here at all, right?
Matter of fact, that's not helpful.
That's not helpful at all. No. But I think what we're trying to struggle with and what we're trying to understand here is that there's an approach to how we approach our problems, right? There's a way that we approach our problems, and in fact, that there's a term for that in psychology. It's called the locus of control, and it has to do with how where you feel your sense of control comes from, right? And the stronger your internal locus of control is, in other words, the more you feel like you have control over your life, the more resilience you have. That's what studies have shown. The more you feel like your control is outside of you, the less resilience you're shown to have, right? And what that means is so like say a student's given a test, right? And he does poorly on the test. A student with a strong locus of control will feel that they did poorly on the test because they didn't study hard enough. A student with a low level of internal locus of control will feel like it was something that the teacher did, or it was something that the way the test was written, right? And so I don't want to, well, I shouldn't use that term, like victim mentality, right?
Yeah,
it's
yeah.
kind of starts to approach that.
I think
right?
that's a fair. If I'm looking at it from a business owner perspective, right? And I know entrepreneurs can probably really relate to this. We hear our clients talk about this all the time. How it's so hard to hire people and it's so hard to get them trained and retain them because of that victim mentality. That's a fair word.
Yeah, and I've heard that too, and I've seen that, right? I mean, I think that a lot of people entering that workforce, there's this sense of, and I think we mentioned this in kind of our initial conversation, that respect, our generation, it's more like the respect is something that I need to earn from you, right? I'm going to give you a good hard day's work, and I'm going to respect you, and that respect's going to grow during our course of employment. Whereas, some of these younger employees that come in, well, you have to respect me, right? Because I am.
So instead of saying it's a victim mentality, I'd be more appropriate if I said you have a low
emotional flexibility.
You have low emotional flexibility.
Yeah, I see that.
The term emotional flexibility.
I see that a lot in younger people today. They have a hard time adapting emotionally to what's going on around them.
And I think, again, to go back to like the original piece of this, and we can talk about generational differences, but I think a big part of that is, again, going back to your original thought, is the social media thing, right? Like, social media came out when I was 14.
Yeah.
Right?
Yeah.
So like it's been around my entire life.
Right.
Kids my age, it's been around their entire lives, or good portions of it, at least 50% of their life at this point.
My college professors didn't even all have an email.
Right.
Yeah.
Right.
Yeah.
So that's what I'm saying. So I think that's a huge proponent of this, is that social media thing, is that they're constantly comparing themselves to others, and they don't know how to be alone with their thoughts. And like there's so many pieces to that I think then manifest it in the victim mentality or whatever, right? Like I think the root of that can be like this social media thing that's hard to overcome. And it goes back to like our conversation is digital marketers and all that stuff. So
here's the secret to life, right? We can sum everything up right here.
Okay.
Ashton has a secret to life.
Listen closely, Katie. Let's take notes here.
If this is your expectation and this is reality, the bigger the gap is between those 2 points, the more pain and suffering you will experience in your life. The closer those 2 points are together, the more peace you will have in your life. That's really what we're talking about here, right? If you want to have more peace in your life, if you want to have better mental health in your life, reduce the pain and suffering in your life, right? And emotional pain and suffering comes when we don't accept the things we can't control. I mean, really, that's
a great secret to life. That's an awesome secret to life.
And it's funny because I'll say that kind of stuff to people in counseling, right? You're like the first session or two, I talk to them. Okay, yeah, that's nice, right? And then, like 3 or 4 sessions later, 5
back to
later,
expecting.
No. They'll come in, they're like, I have to stop this. I can't keep going this way. Like they'll have that epiphany, right? And it's kind of hilarious to watch, and you have this like kind of internal laughter happening, right? Because it's like, I told you that 2 months ago, buddy.
Right.
And so I can say this, right? One, because I've been through it in some ways, right? From my own personal experiences that I've had in my life, right? 2, because I've seen it clinically happen, right? But at the same time, you don't recognize this until you've reached that point in your life, right? That's one of the things AA talks about, Alcoholics Anonymous, all your 12-step programs, right? That they're all kind of based on that same principle, right? You have to accept things. You have to accept what you can't control, right? The serenity prayer, God, give me the strength to accept those things that I can't control and the wisdom to know the difference.
Yeah.
So I can't even remember down
It's
exactly.
the whole secret to life thing. I think that's such a great mindset to have. What would you say? So obviously, I think we're talking about some of those instances where the pendulum has swung one way or another, or maybe the pendulum has gotten stuck. For those people that maybe it's gotten stuck to a point that they can't maybe discern the difference between their expectations and reality. What's kind of a first step? Like what are some things that they can do? Obviously, reach out to a mental health professional, but what are some things that they could maybe start doing internally to start overcoming some of that anxiety or that depression? What can they do?
Well, as I mentioned, the first thing, right, is, well, not the first thing, just as I mentioned, right, you can't continue to avoid those things that are causing you problems.
You have to kind of hit them head on.
Yeah, you have to face them, right? Yeah. At some point, right, you have to face those things that are bothering you, or they'll continue to eat you up. We see that in trauma, right? There's a great book. I forget the name of the author at the moment, but it's called "The Body Keeps the Score," and it's about trauma and its effect on the body from people who've had severe trauma happen in their life, right? And how trauma manifests not only psychologically but physically, in people. And so it just starts to eat you up after a while, right? Anecdotally, look at literature and in movies how bitterness destroys people over periods of time, right? And so those things have to be faced, right? And so asking for help, right? Reaching out to someone, asking for help.
And just to kind of clarify, does that always mean a mental health professional? What might that mean? What might that look like just in everyday regular life?
Yeah, I don't know if it always means a mental health professional. When just to speak from personal experience here, about 7 years ago, I had a horrible experience in my life. My daughter was killed in a car accident. I was in Pocatello. And my wife and children were driving back to home, and a truck driver lost control, and it was a head-on collision, and my daughter was killed instantly. And so it was way out of my control. You talk about things in your control, right?
Right.
And it destroyed our family, right, in a lot of ways. And
in a split second.
Right? 1 second, I'm a grad student, everything's fine, and we're getting ready for Thanksgiving, and the next second, I'm picking out a casket for a 7-year-old daughter.
Ugh.
Right? So, night and day, right? And so, at first, I didn't necessarily go see someone. It took me a couple weeks, couple months actually, right? But I did go see someone, and I've seen a therapist a few times since then, and I've been on a medication a couple times since then, right? So it's not always mental health professional may or may not be the answer, right? But it's about recognizing when you need help, right? It's about recognizing when you've reached a point where I'm not able to function.
I'm stuck.
I'm stuck. I can't keep going the direction that I'm going. Now, I know a lot of people are anti-medications and things like that, or big pharma, things like that. And I think when we're talking about patients who have like very severe levels of mental health issues, to the point where they're like seeing voices and hallucinations and stuff like that, pharmaceuticals have a very key role in their treatment, right? And I've seen those things work firsthand. When we're talking about things like depression and anxiety, I think what medications do is they open the door for you to move forward.
Oh, I like that.
They open the door so that pendulum can start to move, right? Does that mean you're going to be on an antidepressant the rest of your life? I don't know, right? Yeah. And you don't know that answer either. But I can tell you that once those medications start working, you're going to feel better than you do now, right? And that's going to help you feel more better and more motivated to try, right? And to try and do something about the depression, to try and do something about the anxiety. And it'll help you take some of those initial steps. And will you get back to a point where you can start to function independently again without those things? Sure. I've seen that happen, right? Yeah. So just like people take medications for diabetes, blood pressure, migraines, or a cold, right? Those things aren't permanent, right? They don't have to be permanent, right? They can open the door for you to move forward, right? But they don't have to be a be all and end all.
Yeah.
But again, I love the visual of they help the pendulum get unstuck. Like it's also not, it's not a cure all. It's not a magic pill. You know, it's a pill, but it's not a magic, right? No. It's a piece to help you, to get the pendulum unstuck. So then maybe you can start meeting with a counselor, someone to start moving the pendulum back.
Psychotherapy, when we're talking about things like depression and anxiety, psychotherapy accounts for far more efficacy in change than the medication does. Right. But the medication does help, right? I love that. And that's generally speaking, right? Yeah. Your extreme cases, there's are always going to be different, right? But your general cases, and your averages, right? Your psychotherapy is really going to be what helps a lot. And then speaking to that for a second too, they drilled this into us in grad school like you wouldn't believe, right? The relationship between the counselor and the patient is the single most influential factor in how effective psychotherapy is, right? So just because if you go see a therapist and that doesn't work out the first time, don't let that stop you.
Go see a different therapist.
Go see a different therapist. Yeah. Because that relationship is what's going to make the session work, right? So
just like some personalities click better with other personalities.
Yeah. I've had patients before where I've been 5 minutes into the session and I'm thinking to myself, this isn't going to work.
Yeah.
We're not speaking the same language.
Right. Yeah. And that's fine. And what gets weird is when they show up for session 2.
Yeah.
Right.
Because they don't know, they can go somewhere else.
They think if it doesn't work with this guy, it's not going to work anywhere else. Right.
Yeah. And so, I mean, that's okay, right? You tell your therapist, hey, I don't think this is working. We're not going to take it personally. We've got thick skin in this industry, right?
Yeah.
Find another one, right? Find someone else to work with, right? Keep trying, because once you do find that therapist that you click with, man, it'll be a totally different world as far as who you can work with and who you can talk to. Yeah.
Well, let me go back just a minute, because first of all, I really appreciate you sharing the story about your daughter. I know we've talked about that a little bit before too, and a lot of your personal experience and empathy comes from that, and I really appreciate you sharing that. But I know last time we talked, you said something that's really kind of stayed with me. I asked you the question something like, what do we do when somebody comes to us with it, right?
Oh, yeah.
What do we say? Do you mind sharing that experience that you had? Because I thought it was so profound, and we can just remember it and use it.
Yeah. So this was a few days after the accident happened, and my wife's friend came over and to offer their condolences, and her husband was with us, or with her, and my wife was pretty badly hurt in the accident. She actually almost lost her foot, and she's doing quite well now, though. She's had about 7 surgeries, and she's back to walking again and doing really good. And anyway, we're sitting there on the couch, and I didn't know her husband very well, and if he listens to this, I probably should apologize to him.
Do you listen to this? We're sorry. Katie asked him the question and put him on the spot here.
But
But I like it because we do that. We
do this
with the best of intentions.
Yeah. He sat down with us, and they're of course offering our condolences, and when you're offering grief condolences to someone, the person who's grieving, just as a education, I guess, the person who's grieving often feels like they have to comfort the person who's offering them comfort, right? Because we get so uncomfortable that we end up crying and feeling upset, and anyway, it becomes a mess. And so they're sitting there talking to us and telling us how sorry they are for the loss of our daughter. And he asks how we're doing. And I'm honest. I'm like, I'm mad. I'm angry, pissed. This guy shouldn't have been driving. And his truck was in horrible repair and the tire blew. He shouldn't have been doing what he was doing. And he was way over limit. And, talking about all these things that we knew at that point. And he looks at me and he says, you really shouldn't be that angry. That anger is going to eat you up. Or something along those lines is what he said. And I'm a big guy, right? I'm 6'4", I'm 300 pounds, right? And my wife, I think, said my face went pretty red. And I got up and I said, I need to leave the room right now. And I walked out. And I understand what he was doing. I really do, especially in retrospect. I get it. Yeah. I get it. He's just trying to help, right? But
we don't have a right to tell somebody how they should feel.
No, I don't think we do, right? I don't think we do, especially, how they feel, right? And so and I think that's what shuts us down or shuts others down when they do try to open up.
Right.
Right? Yeah. When people try to open up and talk about, hey, I'm struggling right now, right? I'm having a hard time right now. The discomfort that we feel when they're telling us that, we want to respond in a way that makes us feel comfortable. Not what makes them feel safe and secure, but what makes us feel comfortable. That's our natural response, right? And oftentimes what makes us feel comfortable can be extremely invalidating to the person who's speaking. And that's what happened in that situation, right?
Right.
It was pretty invalidating.
And if you transfer to like a work environment now, and somebody comes in, they get up all their courage, right? Muster up all their courage, and they're just like, I'm stuck. I got to talk to somebody.
Right.
They go in, they sit down with their boss or their manager or their coworker. They're like, listen, this is what's happening. And they start unloading or sharing some real serious thoughts that take a lot of courage to come do. And I've done it. I see other people do it where immediately start giving advice and fixing it, and it doesn't work. So help us understand maybe some better options.
Sure.
When that might happen.
Well, and I think it's important to recognize that not only is it that we want to respond in a way that makes us feel comfortable, and I think we also want to respond in a way that we want to feel like we're helping, especially guys. Guys
always good intentions.
Guys are fixers.
Solution.
Right?
Yep.
Yeah.
How do I fix this? How do I fix
this?
Yeah.
Right. There's a great YouTube video. It's called "What About the Nail?"
Yeah,
right?
It's so funny.
Oh yeah. It's hilarious, right? Yeah. Give me the nail. Let's fix it, right? Give me the hammer, right? Let's remove the nail, right? Where's the problem? Let's get the tape, right? Whatever the problem is, there's a solution. Let's fix it, right? And that's often our response, right? and I think it's important to acknowledge that because I think that those intentions they're good, right? We just need to steer that in the right direction, right? And so I think the first thing is just shut up and listen first.
Yeah.
Right? Just listen, right? Listen to what's being said. We talk about this a lot actually in NVCI, in the nonviolent crisis intervention training that we do, where when someone's really upset, when they're angry, we'll talk about their islands of sanity, right? Everybody has their island of sanity, right? Everyone has that thing that you can connect with, right? And listening for that is really important, and trying to connect to that, right? And so you have a coworker come in, they're upset, they're unloading, as you put it, right?
I know that was probably the worst term I could have possibly used right there.
No, it's great. It's great. That's real, right? That's real. That's what we do, right? And so they're unloading, and just listen, right? Give them 5 minutes, right? How long can they actually unload for? Really? Honestly, right? How long is it actually going to take? Just a couple minutes. Yeah, give them that couple minutes. And then I think, from an employer's standpoint, the state and the rephrase, right? It might sound oversimplistic, but okay, so what you're telling me is your problem is this, right? So anything that we can do to validate what it is they're saying, right? The other thing is trying to connect what they're saying with the kind of like a bigger problem, right? So that what's an example of that I can think of? So maybe it's a conflict between two staff members, right?
Yeah.
You know, so-and-so's not showing up or so-and-so's not pulling his weight, right? Da-da-da. So are you telling me you don't feel appreciated?
So the problem isn't really that the guy's not showing up.
Right.
The problem is you don't feel appreciated.
Right. Maybe throw that out there, right? Because that might open up another conversation that they're wanting to have that they're maybe not saying, right? So connect it to kind of maybe like try connecting it to like a larger.
It's a great example. Yeah.
Issue that might be going on, right? Try to read between the lines, I guess is what I'm saying with that, right?
Yeah.
And then our body language. That was the other thing I was going to say. I had to think about that for a second. But our body language is huge when it comes to offering validation to people, right? What we say is way more is communicated to people by how we're sitting, like eye contact, facial expressions, body language, posture. Those kind of things are huge when it comes to communication. And if we don't want to talk to that person, it's going to be evident on our face.
Don't be scrolling through our phone while they're sharing those thoughts.
Body language, make eye contact. I love that.
Put the phone down.
Put the phone down. Pay attention.
Yeah. And the other thing I would say too, because one thing I've done a few times, we earlier we talked about this younger generation entering the workforce. One thing I have done on the side a couple of times is I've kind of coached some new college grads and kind of helped them with some of their expectation.
Because this emotional resilience thing,
exactly,
that's not taught in school.
No, it's not. It's not. And so I've actually done some coaching with some new college grads going into jobs, helping them transition from college environment to work environment. And one of the things that we've talked about is kind of how to navigate that a little bit, right?
Yeah.
What do I do? How do I manage this, right? And I just went blank.
Well, I'll tell you, like I have those new college grads coming in and working here. A lot. We have a lot of them, right? Hayden?
A lot.
And it's not uncommon. Sometimes we're their first job. And so I feel like one of the first things we're doing is teaching them how to have a job.
Yeah.
And so already their pendulum's a little bit swinging because they're in an uncomfortable environment. They're doing things they haven't done before. They're feeling a little bit insecure, right? And one of the first things we have to teach is what does it look like to
how to be how to be a business professional.
Like, guess what? It's not okay to look at TikTok for 3 hours out of your work day.
Yeah.
And in my head, I'm like, you shouldn't have to teach this.
Right.
But you do.
Yeah. Well, it's like setting expectations, right? If you can't set these expectations about what you're expecting from them, then you're going to have some issues, right? And that brings back what I was going to say. When we're talking about how to, I guess, help individuals develop some emotional flexibility, right? One thing I think an employer could do that would really help that is to maintain consistency with an employee, right? Consistency is huge, right? So when we're from a therapeutic standpoint, when I'm working with a client who has some emotional inflexibility, right? Or is emotional.
Well, that's a very nice way to say that. Emotional inflexibility. And we want to get
emotional flexibility.
We want to get ourselves to a place where we have emotional flexibility.
Right. Yeah. So I'm going to test that inflexibility, right? I'm going to slowly work.
Can you touch your toes yet?
Your emotional toes.
Yes.
Yeah.
Yes.
Right? I'm going to slowly work that. So I'm going to test their emotions, right? Therapeutically, right? I'm going to make them struggle emotionally in the confines of a therapeutic setting, right? And then pull back, push and pull back, right? And so I think employers can, and I'm going to do that consistently, right?
Yeah.
And I'm going to do it in a consistent environment, right? And part of that, you have to remember that part of that emotional inflexibility comes from an environment where boundaries were not very clear for them growing up, right? And so if an employer can set clear boundaries, that's going to help them. That's going to help them ultimately in developing.
I've actually read a lot of research that the more clear an employer can get with boundaries and expectations, the higher performance is because anxiety lowers.
Oh yeah, it's huge. It's huge. Yeah. In fact, that's one of the reasons why anxiety happens, right? Is because if I don't know what my limit is, right, I'm going to fill the space between my behavior and what I think the limit is with my
worries.
Yeah. And I'll take a little bit of a step. Okay, well, he hasn't pushed back on me yet. Well, I'm going to take a little more, and so it just, so the more clear and defined an employer can be on what you expect from me, when you expect it by, the better, the better your performance you're going to get. I would agree with that 100%. Yeah.
Ashton, there's been so much good that we've talked about that I don't think it would work for us to just have you on for one episode. So I think what we're going to do is we're going to take this first piece and call it part 1.
Sure.
Okay. So for our listeners at home, we're still going to continue to talk to Ashton, but we're going to break this up into a couple of parts here. There's so much more that I think we could go into, especially when it comes to the workplace, because we're in our workplace here recording this podcast, but also we talk to clients all the time that are dealing with how to help their employees better in their own workplace. And so I think we want to talk a little bit more about some of those things, as well as just all things mental health. And so we're going to take a little break. We're going to pause here and close kind of this first part of this mental health series. Thanks again for coming on. We're going to be continuing to talk to you a little bit more as we go forward, but I think that's a good way to close out part 1. What do you think, Katie?
Yeah, no, I really appreciate it. And I look forward to continuing the conversation around emotional intelligence. That's something I know our company has put a big focus on in 2023, and understanding ourselves a little bit better, to have maybe a little bit more emotional flexibility and understanding. And then also some of the ACT. I know you're certified in ACT, and I'm really interested. Is it ACT? Did I call it the right thing?
Yeah.
I'm really interested in diving into that a little bit more, so that we can maybe get ourselves a little more flexible by learning skills.
Yeah.
So, thank you so much.
Thanks, Ashton.
Yeah, you bet. Thanks for having me on.
This has been Success Elevated, making you a little bit better one show at a time. Thanks for joining us. Please subscribe on YouTube or any other major podcast platform to listen to more episodes. We are proudly brought to you by Spot On Solutions. If you'd like to learn more about how we can help you grow your business, please check us out at spotonsolutions.com.